Welcome to the third and final lecture on the integumentary system. In Lecture 1, we built the anatomy and physiology of the skin. In Lecture 2, we covered the diseases, diagnostics, and medications. Today, we bring it home. What do you, as the medical assistant, actually do at the point of care? This is the lecture that turns knowledge into hands-on practice. We'll walk through your core responsibilities with the skin, assessing and documenting, assisting with wound care and minor procedures, collecting specimens for the lab, educating patients, and preventing infection. And we'll spend real time on the boundaries of your role, what falls within your scope of practice, and what belongs to the licensed provider. Keep one theme in mind throughout. You are the eyes, the hands, and the safety net at the bedside, but you always work under the provider's delegation and never make the diagnosis. Everything we covered today sits inside that framework. Here are our 5 learning outcomes, all focused on what you do at the point of care. First, perform and document a systematic skin and wound assessment, and do it in objective, describable terms rather than conclusions. Second, assist with wound care and minor procedures using aseptic technique and, when required, a sterile field without contaminating it. Third, collect and handle skin and wound specimens correctly so the lab gets a reliable sample. Fourth, provide patient education on sun safety, skin self-exams, and the care plan using content your provider has approved without stepping into giving new medical advice. And fifth, apply standard precautions with every patient and stay firmly within your scope of practice, escalating to the provider whenever something needs a clinical decision. Keep these 5 in mind. The summary will tie back to them. Here are the medical terms that you need to know to understand this lesson fully. Take a moment to look them over. We'll use each of them as they come up on the slides ahead, so don't worry about memorizing the definitions right now. Just get familiar with the words. Take some time to pause the video to take your notes. Before we get into the nitty-gritty details, here's the whole job on one slide. 6 areas of responsibility that we'll unpack over the next several slides. You assess and document. You inspect the skin and wounds and record exactly what you see. You assist with care and procedures, dressing changes, biopsies, and other minor procedures. You collect specimens, cultures, and samples that go to the lab. You educate patients, reinforcing sun safety, self-exams, and the treatment plan your provider set. You prevent infection, standard precautions, and hand hygiene with every single patient. And you work within your scope, performing delegated tasks and escalating anything that needs a clinical decision. Notice the thread running through all 6. The phrase at the top, always under the provider's direction. That's not a limitation to resent. It's the structure that keeps patients safe and keeps you legally protected. Every one of these 6 areas operates inside it. Let's take a look at them one at a time. First responsibility, assessment and documentation. Because you're often the first person to look at the patient's skin, a careful, systematic assessment is one of the most valuable things you do. Go in the same order every time so you don't miss anything. Color. Integrity. Is the skin intact or broken? Temperature, moisture, and any lesions. For anything you find, capture 3 things: where it is, how big it is, and the plain description. Then document promptly and accurately in the electronic health record and report anything abnormal to the provider rather than sitting on. If you notice a new or changing mole, flag it using the ABCDE features from the last lecture. But flag it, don't label it. That's the key idea on the right. Describe, don't diagnose. Write what you observe. For example, A 2 centimeter round, red, raised area on the left forearm that's warm to the touch. Do not write infected or skin cancer. Those words are clinical conclusions, and drawing them is the provider's job, not yours. Objective, specific description is both within your scope and genuinely more useful to the provider. Second responsibility, assisting with wound care and measuring wounds. When you help with a dressing change, you'll use either clean or sterile technique depending on what the provider ordered and the type of wound. If it's a sterile procedure, your job is to set up and protect the sterile field. Open supplies correctly, keep everything within the field sterile, and never reach across it or let a non-sterile item touch it. A single careless move can contaminate the whole field. As you work, observe and report. What does the wound bed look like? How much drainage and what color? Is there any odor? And photograph it if your facility's policy calls for that. Then measurement on the right. Every wound gets measured the same way, length by width by depth in centimeters. Check for tunneling, where the wound bores in one direction, and undermining, where it extends under the skin edges. Measure at each visit so the trend shows whether the wound is healing or getting worse. And know your limits. Debridement, which is removing dead tissue, and suturing, those are both provider procedures. You can assist and prepare, but you don't perform them. Third responsibility, collecting specimens for culture. One of the tasks named directly in your scope for this system. The result is only as good as the sample, so technique matters. Step 1, cleanse first. Clean the wound before you swab, and sample living tissue from the wound bed, not the pus or the dead slough on top, which can give a misleading result. Step 2, use the right kit. Different cultures need different swabs and transport media, bacterial, fungal, viral, so use the correct one and follow your lab's requirements. Step 3, label at the bedside. Full identifiers, name, date of birth, the site, the date, and time, and your initials. And label it in front of the patient before you leave the room so it can never be mixed up. Step 4, transport properly and handle every specimen as potentially infectious. Gloves on, contain it properly. Bottom line ties it together. Accurate collection gives the provider reliable results, and reliable results are what let them choose the right antibiotic. A sloppy sample can send treatment in the wrong direction. Fourth responsibility, assisting with procedures and chaperoning. Dermatology and primary care do a lot of minor skin procedures, and you make them run smoothly. You set up for a skin biopsy, cryotherapy, which is freezing a lesion, or an incision and drainage of an abscess. You prepare the tray and the sterile field. Before anything starts, confirm the consent form is signed and in the chart. You position and drape the patient so the site is accessible while keeping them comfortable and covered. During the procedure, you pass supplies, and when tissue comes off, say like a biopsy specimen, you manage and label it correctly because a mislabeled biopsy is a serious error. Afterward, you clean and turn over the room per protocol. The card on the right is about chaperoning, which matters especially for skin exams that involve sensitive areas. Your presence protects both the patient and the provider. Offer reassurance, safeguard the patient's modesty, and document that a chaperone was present. It's a small step that prevents big problems. Fifth responsibility, patient education. A task you're absolutely permitted to do as long as two conditions are met. The content has to be approved by your provider, and you must not exercise independent clinical judgment while teaching. You're reinforcing the plan, not creating it. The big topics for skin are on the left. Sun protection is number one, and the quick version is on the right. Broad spectrum sunscreen of SPF 30 or higher, reapplied every couple of hours. Hats, sunglasses, and shade, and limiting sun during the peak hours of about 10 to 4. Teach patients to do skin self-exams using the ABCDE signs and to call the office if they spot something. For patients going home with a wound, walk them through dressing changes and the signs of infection to watch for: increasing redness, warmth, swelling, drainage, or fever. And review medications, exactly how and when to apply topicals, and why finishing the course and sticking with it matters. The last bullet is the guardrail. Reinforce the provider's plan, but don't offer new medical advice. If a patient asks something that needs a clinical decision, that goes to the provider. Sixth area, infection control. When you work with skin and wounds, you're working right at the body's barrier against infection. So this is central to everything you do. The governing idea is standard precautions. You apply them to every patient, every time, and you treat all blood and body fluids as potentially infectious regardless of what you know about the person. 4 pillars are on the cart. Hand hygiene is the single most important measure to prevent the spread of infection. Wash or sanitize before and after every patient contact and every time you remove gloves. PPE, gloves, gown, masks, and eye protection match to the task. A dressing change with splashing needs more protection than a quick skin check. Sharps and waste. Handle needles and blades safely, never recap by hand, and dispose of everything in the correct containers. And clean between patients. Disinfect surfaces and any shared equipment after each one. None of this is really glamorous, but it's the difference between a clinic that protects patients and one that spreads infection. You are on the front line of that. The last and most important professional topic, your scope of practice. Medical assistants are unlicensed personnel. Your authority to act comes from your supervising provider's license, which means you perform only the tasks that a provider has delegated to you and that you've been trained and found competent to do. The 2 cards make the boundary concrete. On the left, within your scope, assessing and documenting objectively, assisting with wound care and procedures, collecting and handling specimens, providing provider-approved education, and applying standard precautions. Essentially everything we covered today. On the right, things that are not your role: diagnosing or interpreting results, prescribing medications, performing invasive procedures like biopsy, suturing, or debridement, making independent clinical judgments, or working without supervision. Scope also varies by state and by facility policy, so know your local rules. And when you're unsure, the safe move is always to ask. And the green bar is your escalation trigger. Get the provider promptly for spreading redness, uncontrolled bleeding, severe pain, a suspicious lesion, or any patient who simply looks really unwell. Escalating isn't failing. It's exactly the right call, and it's often the moment your role protects a patient the most. I know this is a lot to know. Rest assured that we have structured our MA program so that you learn the material, then get to practice what you've learned in a lab setting. Your basic and advanced medical assisting courses will review this material and allow you to practice the skills in lab. So don't worry, we got you. Let's bring the whole lecture together. Here are 6 takeaways. 1. You are the hands-on link in skincare. You assess, assist, collect, educate, protect, and escalate, always under the provider's direction. 2. Your assessment and documentation must be systematic and objective. Describe what you see and never diagnose. 3. Wound care and procedures rely on aseptic technique and a sterile field that you set up and protect. 4. For specimens, cleanse first, sample viable tissue, label at the bedside, and transport correctly. Good samples give good results. 5. Standard precautions and hand hygiene with every patient are the heart of infection control. And 6. Work within your scope under delegation. Know your limits and escalate red flags to the provider. That completes our 3-lecture module on the integumentary system, from anatomy and physiology to disease and treatment to your role at the bedside. You now have the full picture of the skin as a body system and of your role as an MA within the system. Here are the references that were used to put this lecture together. Feel free to check them out.